Hello dear friends, welcome back to Lesson for You. Dear friends, we are discussing about the skeletal system of the human body. Now in the previous lecture we have covered about the hip bone. It's all important landmarks I have already discussed, right? Okay, now we are going to discuss about the bone which is in very important contact with this hip bone, right? So as you can see here, I have in my right hand the hip bone and my left hand the femur. So here in this lecture we are going to discuss about the longest bone of the body and about the heaviest bone and about we can also say the strongest bone of the human body, that is called the femur or the thigh bone, or we can also call it the shin bone, right? So let us begin our lecture. We are talking about the femur. Femur, right? Femur is also known as thigh bone, right? Or it is also known as the shin bone. We just say that it is the longest bone of the body, right? Longest bone, heaviest bone, and we can also say that it is the strongest bone of the body. After we have the other stronger bones also, we say that the skull bones are the most strongest bones of the body, but it is the weight bearing bone of the body. We can also say that the strongest, the heaviest, the largest, the longest, and the weight bearing bone of your body is called the femur bone, you can say. This is located. What is its location? So you can see that the femur bone begins at the hip joint and ends at the knee joint, right? This is our tibia, right? So if this is tibia, right, and this is the lower part of the femur bone, so this joint which both of them make is called the knee joint. So your femur bone ends at knee joint and begins at hip joint. So we say that it begins at hip joint, right, and ends at knee joint, right? These are the basics of this bone. Now then, what is the length of this bone? So the length varies, but average length is 48.4 centimeter is the average length of this bone, 48.4 centimeter. Now it has parts, and we discuss this bone in three parts. As in the previous lecture I discussed about the anatomy of long bones. So I had told you that long bones have three important parts: the upper part, the middle part, and the lower part. All the long bones have these three parts. The upper epiphysis, lower epiphysis, or we say proximal, distal, and this is diaphysis, or this diaphysis is known as shaft, right? This is upper end and this is lower end. So we will discuss the important aspects of the femur bone in upper part, then we will discuss its shaft, and then we will discuss its lower part, right? So we divide the femur bone into how many parts? Into three parts. First there is upper end, right? Then there is lower end, right? And then there is the shaft of this bone. So we will discuss the features of every part of this bone. So the upper part, middle part, and the lower part. So first we will discuss about the anatomy of the upper part of this femur bone. So let me begin my lecture here. Upper end, right? The upper end of the femur will be discussed under 5 or 6 titles, and what are those? Look carefully. From here above This is the upper end, and from here downward, this is the shaft of this femur bone, right? Okay, look carefully. This part, I'm talking about upper part. So upper part has also some other parts. This is the head, right? This part is the head. Then there is the neck, right? My dear friends, I'm just introducing this bone, right, in this video. In the next video, we will show you in front of the camera all the aspects of this video practically. We will apply this theory on this bone. Don't worry, right? Right now in this lecture, I'm not showing all the parts of this bone to you guys. But here we are just writing theory of this bone. What are those parts? Then we will show you them. As we did in the previous videos. Head, the neck, right? The greater trochanter, the lesser trochanter, right? Intertrochanteric line and intertrochanteric crest. And then there is some depressions, the fovea, right? Then there is the apex, then there is the tubercles also there. We will discuss all these and we will show you all these in the video while we discuss about this bone itself, right? So the head, the upper end has what? Let's write there. The upper end has a head, then it has a neck, right? Then it has a greater trochanter. I hope you are understanding. Then it has a lesser trochanter, right? And then it has greater trochanter, lesser trochanter, intertrochanteric line. I will show you all these. And then there is the intertrochanteric crest, right? So we will discuss all these parts in the upper part of this femur bone. Let us begin with the head. First part, the head. The head of the femur bone is actually present medially, right? As this is your pelvic bone, right? And this is the joint, the hip joint, right? So you can see here, this is the mid of the body, right? This is the mid side of the body. So the head of the femur is pointing medially, upward, and a little forward, a little bit forward. You can see here. If I show you with the other bone, other femur bone, I have also the right and the left, both I have, right? Look here, this is the right femur. So the head of the femur, right, is present. It should be located medially, upward. You can see it is upward a little and a little bit forward. It should be located like that. So about the head of the femur, we say that the head of the femur, first of all, it is more than a half circle. It is a little bit more than a half circle. So for example, if this is the complete circle, right? So the head of the femur is this circle, right? So it is a little bit more than a half circle. So let me write here, it is a more than a half spare. We don't use the word circle, we use the word spare. So it is more than a half spare. Done. Then the next point about it is that it is located medially, upward, you saw right now, and a little bit forward. So this is the exact location. Look carefully. It is, the head is medially there. The head of the left femur will be also medially, right? Upward and a little bit forward. This is the exact location of the head of the femur. Then the next point about the head of the femur is that it articulates at acetabulum, right? You know, acetabular fossa, there we have, this is the acetabulum. So it articulates with the acetabulum, at acetabulum, to make which joint? To make hip joint. Done, right friends? And the next important point about it, that it has a rough pit in it. It has a very small depression in it, which is medially. So this rough pit is called the fovea, to which the ligamentum femoris is attached and makes the, it holds the femur to the acetabulum, right? So if there is the acetabulum, right, and here is the head of your femur, so the head has this rough pit, and there is the connection of the ligament between the acetabulum and the head of your femur. So we say it contains a rough pit, which is called what? Which is called fovea. Right, I will show you these important points. So this was about the head of the femur. First, the head of the femur is located medially, for upward and forward, right? And it is more than a half spare, right? It articulates with at acetabulum to make the hip joint, and it contains a pit, a rough pit, which is called the fovea. These important points are about the head. Then we move towards the neck. The next point about the upper end of the femur is the neck of the femur, right? The neck of the femur starts, right? I will show you here. It begins at the end point of the head, right? And it goes up to the line and the crest, right? This part which I am holding here, this is the neck of your femur, right? Neck of the femur. So the neck of the femur, right, it is about 3.7 centimeter, right? Then we say it has an upper border and a lower border, right? About borders of it, it has how many borders? It has 2 borders, and then it also has surfaces. So how many borders? It has, my dear friends, 2 borders. How many surfaces? It has 2 surfaces. And what are those borders? First, there is an upper border, and then there is a lower border, right? There is anterior surface and posterior surface. So let's go for it. There is an, how many borders? There are upper border, and then there is a lower border, right? About the upper border, first point about it, that this upper border is little bit horizontal. I will show you while I'll discuss about the bone itself. The upper border is a little bit horizontal. You can see it here. This is the upper border. So it's a little bit horizontal, but the lower border is little bit oblique, right? You can see my hand. The lower border is a little bit oblique, and the upper border is little bit horizontal. So I will write here the points. The lower border is little bit oblique in nature, right? And upper border is horizontal. The next point about it is that the upper border is little bit concave, right? You can see here it has a concavity, it has a depressed part. So the upper border is horizontal and concave, and it meets the shaft, right? Look carefully. Here is the head, and here is the shaft of the bone, right? So in between the head and the shaft there is the neck. So the neck, we say that it begins here and comes towards the shaft of the bone. So the upper border, right, meets the shaft of the bone at the greater trochanter, right? I will show you again. So it meets shaft at greater trochanter. Right, there is the greater trochanter, we will discuss later. So these are the three important points about the upper border of the neck of the upper end of the femur. That is the upper border is horizontal, it is concave in nature, it meets the shaft of the bone at the greater trochanter. Then about the lower border, as I told you, it is somewhat oblique, right? It is somewhat oblique, and it meets the shaft of the bone at the lesser trochanter, right? So it's quite simple. This is the greater trochanter, this is the lesser trochanter. So this is the lower border of the neck. The lower border of the neck meets the shaft of the bone at the lesser trochanter. This is the important points. Meets shaft at lesser trochanter. These important points are written in the book. That's why I am mentioning all these. Right. Then there are two surfaces. And what are those surfaces? There is the anterior surface and there is the posterior surface. If this is the right knee, femur bone, so this will be the anterior surface, this will be the posterior surface of the neck, anterior and posterior. Let's go for it. How many surfaces it has, my dear friends? It has it has two surfaces, the anterior surface and the posterior surface. Right, friends, done. Anterior surface and posterior surface. The anterior surface, look carefully, the anterior surface meets the shaft of the bone at the intertrochanteric line, right? This line, this red line shows the intertrochanteric line. Now this is the anterior surface, so we just say that the anterior surface of the neck meets the shaft of the bone at the intertrochanteric line. Let me write it here. Meets shaft at intertrochanteric line. Right. And about the posterior surface, so we say that the posterior surface is a little bit convex in nature, right? The posterior surface is a little bit convex, right? And the convexity is from upper part to the lower part, it is convex, but from side to side it is concave in nature, right? I will show you in the video about the posterior surface. So we say it is convex and it is also concave. So it is convex from upper to lower part, right? If you go from upper part to lower part, it is convex, but if you watch it side by side, it is concave, right? Okay, and it is convex, we say that it is convex from above downwards. Right. So let's go for it. Above downward it is convex and side by side it is concave. I will show you in the video. And then we say that it meets the shaft of the bone at the intertrochanteric crest. It meets the shaft at intertrochanteric crest. Right, friends, you just write the theory here, then we will go for the practical video, for the practical of this video, and I will show every point in this video. So this is the neck, right? Head, this is the neck. The neck has two borders and two surfaces, upper border and lower border, anterior surface and posterior surface. Anterior surface meets the shaft at the intertrochanteric line and posterior surface meets the shaft at the intertrochanteric crest, and the posterior surface is concave above downward, convex above downward, and concave side by side. Right, friends, then we go, this was about the neck of this the upper end of this shaft of this femur bone. Now look carefully, friends, this femur bone, actually there is an angle between the shaft and the neck of this femur bone, so we call it the neck and shaft angle. neck shaft angle. Look at the diagram here. Here is the head, right? Then there is the neck, okay? Then there is the lesser trochanter, and then there is the shaft. Here is the greater trochanter, and this is the shaft, right? Now if you keep your marker here or your pin here, here is the formation of an angle, right? So if you make a line in this manner and in this manner, so if this line represents the shaft, right, and this line represents the neck, so here is the formation of an angle, right, which is about 125 degrees, right? So you just remember the neck shaft angle of the femur bone is about 125 degrees, right? This was about the neck and the head. Now we go towards the greater trochanter and lesser trochanter.